Hello guys, how is everyone doing today? I hope your NCLEX reviews are going well. I recently received several emails in regards with failure and people failing their NCLEX exam. Now, whether or not it's your first time or multiple times that you do have taken your NCLEX exam, to be honest, I don't really exactly know what the actual average times a nursing graduate takes an NCLEX exam before passing it, but personally, for the most part, I would say that maybe about 55 to 60% of the time from the people that I do personally know had to take it more than once. Now, I think it's just really it takes a lot of persistence and also you have to be mentally tough. You have to be so positively driven that you can reframe your circumstance and tell yourself that maybe having to take the NCLEX exam twice or multiple times before passing it will just make you a better nurse in the future, right? And having to retain all these information over and over again will only benefit you at the end, right? Now, on that note, I say, guys, you got to keep on going, be brave, and at the end of the day, it is your life, so don't even acknowledge any criticisms or any negativity at all, okay? Now, on this NCLEX review video, I'll go over a cardiovascular question that involves a patient with a cardiac monitor, okay? And what action you as a nurse should implement as a priority. So, the question is, a client is wearing a continuous cardiac monitor, which begins to sound its alarm. A nurse sees no electrocardiographic complexes on the screen. Which is the priority action of you of the nurse of you as the nurse? Number one is you're gonna call a code. Number two, call the health provider. Number three, check the client's status and lead placement. Four, press the recorder button on the electrocardiogram console. So first, let's look and analyze the question. We'll look at the major primary issue, which is the sudden loss of electrocardiographic complexes, which is just basically a fancy way of saying not being able to find the QRS complexes, which, as we all should know, corresponds to the depolarization of the right and the left ventricles, right? So basically, this issue can indicate a few possible problems. It can be either a ventricular asystole, which is indicative of cardiac arrest, and that is a very serious problem. But again, that is not mentioned on the question. Therefore, the only other possibility would be that it might be an electrode displacement, right? So the correct priority action for us as the nurse is to have an accurate assessment of the client and the equipment so that we can determine the costs and identify the appropriate intervention. So the correct answer for this one is number three, okay, which is check the client status and lead placement. Also, the remaining options and answers are somewhat secondary to the client's assessment, okay? Now, guys, this is it for now. I'm just going to make it short and sweet. I hope you guys will have a blessed day, and I hope your NCLEX reviews are going well. Again, thank you so much for watching, and please visit the website, which is allnursingnotes.com, okay? Take care, and God bless.